Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation, during the COVID-19 pandemic. Today, we're discussing how the pandemic has affected planned surgical procedures and the anxiety patients may be feeling as a result. Specifically, the uncertainty of surgical procedures being postponed, the fear of being in the hospital during this time, and the post-surgical recovery period being impacted by the new infection control policies. I'm joined by Dr. Darrin Lee from the Department of Neurological Surgery and Dr. Alex Chen, a psychiatry resident at LAC USC. Hello.
Hello. Hi, thanks for having us.
Thank you. We're going to be discussing some common emotional responses patients can feel regarding changes in their surgical procedures and post-surgical care and strategies to help cope with these fears and uncertainties. Dr. Lee, what kind of scheduling changes have you seen as a result of the pandemic?
Well, typically there are two kind of aspects to scheduling. The first is the clinic visits, as well as, and then the second is the actual surgical planning and operating room schedule. So in terms of the clinics, initially we were not really seeing any patients in the clinic. Everything was done via telehealth. As kind of the pandemic kind of developed and we kind of formed a plan for scheduling, we started to integrate both telehealth visits with in-person visits. So currently right now, all of our schedule has been kind of down booked. From the surgical standpoint, again, we weren't doing any elective procedures. And so a number of surgeries had been postponed for months. And we're now trying to start catching up. We were allowed to start doing, again, elective procedures within the last couple weeks. But again, the operating rooms are not at full capacity. So there's going to be a backlog in terms of the number of patients being able to kind of go through the system. And that's, of course, for the safety of our patients, as well as the healthcare providers.
Right. So there's a lot of different scheduling challenges that we have to be mindful of everybody's safety during this time. And telehealth has definitely ramped up, something that we may not have been used to in the past. How do you think the patients have responded to these changes?
I think there's a varied response. Some patients actually like not having to come in from that respect, but others really do want to see their healthcare providers. There's a couple cases where the first time I'm meeting them in person is before the operating room, and that's definitely a different change. I mean, they get to see me and talk to me, but again, there's a certain amount of from not just the patient, but from their families as well, a certain amount of kind of, I think, anxiety that goes along with not being able to meet your doctor in person prior to something invasive like surgery.
That's a really interesting point. You're putting your trust in someone, and it's interesting to think about how you might do that if you've never met them face to face.
Exactly.
Dr. Chen, what do you think about these patient responses and how some have, it seems like, appreciate the fact that they're able to have a different avenue of communicating with their doctors, but then for others, especially for surgical procedures and patients awaiting surgery, it might be even more anxiety provoking.
Yeah, definitely. I mean, with the pandemic, it comes with a lot of changes, and not just in changes in our societal interactions, but also in our medical care, like Dr. Lee has mentioned. And I think that, while some patients may benefit from having less pressures and barriers in getting to their appointments, and therefore might enjoy having a telecare services be available to them, I'm sure a lot of patients are also feeling a lot of anxiety related to not only the fact that they need a surgical procedure, but also that now that they don't have a chance to have as personal a visit with their surgeon prior to the procedure itself. And that combined with a lot of the uncertainty related to schedule changes, infection precautions, and other types of barriers that are caused by the COVID pandemic is sure to induce a lot of anxiety in our patient population. One of the big things I've heard from a lot of my patients is the concern of getting their medical problem treated, but at the same time risking exposure to COVID infection by being in a hospital setting. So they're kind of torn between this dilemma of whether to address their problem as soon as possible by going for medical procedures, but also sometimes deciding whether or not it's worth it to push it back so that they have lower risks of developing the COVID, especially if they have comorbidities that are associated with it. And some of the processes I've gone through with my patients in discussing with them about how to manage this anxiety during this time is really kind of sitting down and discussing their values on like what to them is kind of their priorities and what's important for them, and balancing the risks that they face with the potential benefits that they may have in their daily functioning, their life that they may get from getting treatment versus delaying treatment. And it all starts with having a frank discussion with their medical providers about what is the status of their current illness, how the process for the treatment would go, and what are the official treatment recommendations, including like what are kind of precautions they can have during the treatment procedure, what are probable outcomes, what are post-care needs going to be like, and determining whether or not that set of circumstances is really something that they feel comfortable with, and that they have to balance between what they can control and what they cannot, and that's kind of the uncertainty aspect of it.
Right. So I think we talked about different phases of this process. Initially, it's the idea of like connecting with your doctor and your provider to figure out what is your care. But then now weighing the risks and benefits of postponing versus getting the care at this time, and being in constant communication with your healthcare team. But then also, let's say now you've received the surgery. Now we're in the recovery phase. Dr. Lee, what specific concerns have there been about the recovery process?
Well, I mean, there's actually a number of concerns. At the very beginning of the pandemic, patients' families weren't allowed into the hospital. So, oftentimes in the pre-op setting as well as the post-op setting, after the surgery, I'll talk to the family directly in person, tell them, how the surgery went, if there were any complications, how I expect the rest of the hospital course to go. And they're not able to have that same kind of direct communication as they did before. The patient doesn't get to see their family members during that initial post-op period. And that adds additional anxiety, kind of fear, and even potentially frustration. So in terms of, I guess, the after surgical care, I think that's a big kind of concern from, at least what I've heard from a lot of the patients and their families. And then you add on top of that the actual kind of concern about being in a hospital. The patients and family want to leave the hospital as soon as they can. They have to meet the certain criteria to actually be safe to leave, and that's also another kind of concern that we have to balance.
Thank you for that. That was very insightful. Dr. Chen, any comments to that?
No, I completely agree. One of the things that I always kind of consult patients on, especially when we get a psychiatric consult from surgical services, is to kind of prepare the patient in terms of making sure that they have a good conceptualization of what is going to be the plan for the medical treatment, the procedures, and also like understanding how they're going to optimize their pre-treatment preparations and their post-treatment success recovery through having adequate support systems in place for them. And communication is the largest aspect of that, both in terms of communicating with their providers and arranging for an optimized plan, but also communicating with family and other support structures to ensure that they have a good recovery process planned for post-surgical care. And I think a big part of it moving forward is really going to be trying to see how we can leverage technology that we have for communication, for other services that are already in place, and adapting that to the medical treatment and medical field to allow us to provide our patient new avenues and new ways to access support that would be conducive to minimizing the risks of infection while still giving them good pre and post-operative care.
Thank you. I think there are a lot of good points made here today. Obviously, there is the fear and uncertainty of needing a surgical procedure, and that's just kind of baseline, but now needing a surgical procedure in the time of the pandemic. Then you have a potential barrier between having more face-to-face contact with your surgeon, which some patients might need more of. And then that notion of weighing the risks and benefits of going to the hospital versus postponing. And then wanting to recover as quickly as you can from the hospital, but also understanding that it kind of takes a village, right? We need our support system so that our recovery can be better. And so the key, I think, the takeaway is really discussing with your doctor, understanding what they can and cannot expect from the procedure, from their recovery, how their family members can be the most supportive. And by being better prepared, then they might have more control of the situation and have a better outcome.
Absolutely.
Thank you both for your time. Really appreciate it.
Thank you.
Thank you for having us.